Now, okay, so we've looked at the galaxy, the universe, the galaxy, and the solar system. So now let's get to planet Earth, behavioral health, SUD care. It is no secret to anybody that this White House, their approach to the what they call the drug problem, I prefer the term SUD because I look from a clinical model. Their approach is to bring back the war on drugs. I don't think that's up for debate. I consider myself well-informed, well-read. I just went on for many minutes at the beginning of this podcast trying to explain to you how important it is to be well-informed. What we see in Venezuela, what we see in terms of the focus on the Mexican border, what we see in terms of the focus on fentanyl seizures, the top priority of this administration is on what we call the supply side. I have not yet seen the support I'd like to see on the what we call demand side, which is all those programs that SAMHSA I talked about before. So we are in an environment or a universe, whatever you want to call it, where the White House is bucking a trend that we thought was going in the right direction.
Welcome back to MasterMined. I'm your host, Mark Scrivner, and as always, I'm joined by my fabulous co-host, Jeff Skillen. Jeff, great to have you with us today.
Good morning, Mark. I've really been looking forward to this episode today.
Yeah, man, this is actually going to be a really interesting one, a really good one. I'm excited about this one because in this episode, we're sitting down with Andrew Kessler, principal of Slingshot Solutions, a Washington, D.C.-based consultancy firm specializing in behavioral health policy and advocacy. Andrew, welcome to the show, man. It's so great to have you here with us today and appreciate you taking time out to be on MasterMined.
Well, thank you for the invitation. It's my pleasure.
So, Andrew, this introduction came through our mutual friend, Nikki Soda. And so shout out to Nikki. Nikki, thanks for making this connection. Now, I want to just cut through the bull straight away, okay? So we talk about an advocacy firm. You're a lobbyist, right?
Yeah. Yes.
So help us understand this. What is the difference and what does that mean?
It's a term of art. I don't like the term lobbyist because it conjures up the images of a corporate hired gun. I'm not gonna lie, I am a hired gun, but most people think of a lobbyist as a white collar, what we call K Street firm with lots of people and taking on all comers, regardless. The truth is, for most of Washington, a lot of us have a specialty. And mine is behavioral health. And I just prefer the term advocacy because I work on one subject, which is behavioral health. And if you want to get into the real semantics and the wordsmithing, there is a definition of what a lobbyist is. And I provide my clients with a lot of different services beyond legislation. I do a lot of communications. I do a lot of, we talk a lot about areas of concentration that would benefit the organization in terms of advancing policies. And a lot of what I do on Capitol Hill is not always advocating for specific legislation. It's advocating for changes in attitudes and approaches to behavioral health, because unlike a lot of public health issues, we're still in a phase with behavioral health where we constantly have to educate lawmakers. I mean, I go into a lot of meetings with a lot of lawmakers assuming that they don't know nearly as much as they need to know about behavioral health. So it's not like cancer or diabetes where I can assume that the lawmaker or their staff off the bat knows exactly what I'm talking about. So there's a lot more to it than legislation. So I tend to look at a lobbyist as someone who is laser focused on legislation. I'm more in the whole public affairs space that includes a lot of that communication as well. So in my mind, that's what the difference is.
Well, I mean, we know that to be true, but I wanted to get our I think the listeners and the people in our audience, it's a distinction that needs to be made, and so it's like, we know that you do a lot more than just focus on legislation, but you're in DC, and there's a lot of ambiguity in terms of how the sausage is made, so to speak, and it's like, we're really hoping that you can actually bring
Oh,
some clarity to that.
absolutely. It's one of my favorite topics of conversation. You say sausage, and of course, there's an old saying, what are the two things you never want to witness being made? Sausage and legislation. And, I grew up in an era, of a wonderful, program called Schoolhouse Rock, and you ask anyone my age, what's the most absolute famous Schoolhouse Rock, they're gonna have one of 2 answers. One is Conjunction Junction, which not relevant, not germane to this conversation, but the other is I'm just a bill on
Just a
Capitol Hill.
bill. That's it, absolutely.
And it goes through the very short process of the House passes legislation, the Senate passes legislation, the president signs the legislation, and there you go. No. No, not at all. I wanna start by saying that if we're talking about a brand new piece of legislation, like you say, "I think there should be a law that blank." Um, and someone comes to me and says, "What do you think of this? And what is your strategy and your timeline?" My very first answer is going to be, we're talking a minimum of 4 to 6 years before we even start to get any kind of thoughts, traction, whatever, because you need to gather the right support from the right committees, the right members. You have to go through, is this allowable? Is this feasible? Who will have an objection? It's a much trickier process than people give it credit for. And when all that's said and done, and you finally have the product that you want to shop around, which takes a good couple of years, then you actually have to gain the support for it. Not only do you have to gain the support for it, you've got to find the right procedure for it. Everything breaks down along 2 lines. The substance, does this legislation have support in terms of what it will achieve? But just as important in Washington is, how are we going to get this passed? Because a lot of people think that the biggest problem we face in DC is a political party or a political chamber or a political caucus or a movement. It's not. It's the calendar. There are only so many days in the legislative year that the House and session are in DC, the House and Senate are in DC, and working. So, and more in recent years, I've been at this about coming up on 30 years. And with each passing year, it seems like we have less and less time to work on our priorities.
Well, Andrew, so first of all, we know that that is your unique skill set in the world. Thrilled to have you on the show. I think we would all love to understand, it's like, where's your passion and expertise and knowledge for behavioral health, substance use, mental health? Where does that come from? And then what brings you that passion to the work?
You should have warned me beforehand about how much time I have to answer each question, because I could take the whole session to talk about my passion for this work. It's
We're gonna
interesting.
limit it to the, congressional calendar.
Yeah, yeah. It's interesting because, there's 2 types of professionals. There's many types of professionals in DC, but if you want 2 major categories, there's 2 types of professionals. There's people who love what they do because of the subject matter. So, for example, I work closely with, say, the American Psychological Association, and I know people at that association who are psychologists. They love the practice of psychology, so that's what they advocate for. And in behavioral health, there are people who maybe, have personal experience with substance use or mental health disorders, and that's their passion, so they work on a policy. I know plenty of people like that. The other camp is people who just love policy work, and that's me. And I came to DC to do policy work. Behavioral health is kind of where my career took me. Very short. I did my time on Capitol Hill, went back to grad school to get my degree, came back to advocacy, and got a job with an organization that lobbied, advocated for neuroscience, and learned tons about neuroscience and its role in health. And then I got another job that was more about the clinical side of substance use disorder treatment, and another, and then decided to go out on my own. And what led me to go out on my own, where this all comes together, is for about 6 or 7 years I was working in behavioral health policy, and I those 2 elements that I discussed before, the knowledge of behavioral health and the knowledge of public policy were not meshing to the degree I thought they could. There were very few people working in this space. It was an exciting time because there was starting to be an evolution of, members of Congress paying attention to this, and I just it was gnawing at me that no one is taking a real Washington, D.C. hard-nosed approach to this very, very delicate issue with very passionate advocates. There were some, and some were my mentors, and, I'm gonna give them, recognition. The godmother of this line of work in my mind is a woman named Carol McDade, who, was one of the first people to actually make a living at being an advocate for SUD treatment and recovery, and, I worked with her very closely, from the beginning of my career, and, I just saw this wide open lane of, "Let's play the game right, and let's include the people who really know the substance. Let's get those 2 on the same page and go from there," and that's when I started Slingshot Solutions back in 2008 and been doing it ever since.
Andrew, how about in those early days? What were some of the more like complex challenges that you faced, as starting your business up? I know you're, hard charging, ready to, change the world. And, I'm sure there were some challenges that popped up. What were they?
Yeah, well, the challenge there were 2 challenges. I mean, for me personally, it was, like you said, I'm hard charging, and then I had to stop and say, like, I thought to myself at first, "Oh, I can do that, I can do that, I can do that," and I learned you can't do it all and if you wanna do it well. So, my focus became, "Alright, what am I best at?" And that's being on the Hill. I just it's my place, and, um, the the other half of that equation is, like I said before, we were in a time where substance use disorders were just coming to a point on Capitol Hill where we could get a few members of Congress to understand we need to make the transition from a criminal justice and punitive model to a public health model. There were efforts afoot led by Patrick Kennedy and his father, the late, great Ted Kennedy, and Pete Domenici of New Mexico for something we called substance use and mental health parity, which is equal levels of insurance coverage for behavioral health offered by private insurance. So that was like the main fight, and that was our main gateway to explaining to use that policy proposal to explain to members of Congress what we're dealing with here. People who have mental health disorders are not crazy. They have an illness. People who have substance use disorders, they don't have any, there's nothing wrong with them. They're not weak. They're not, or they don't have a moral failing, as people like to say. They have a healthcare condition. Now, the cause of that condition is as varied as any other healthcare challenge. But, the big challenge on our front was I remember my first big client who signed me and said, "We want you to go make a difference for us." They were like, "You're the guy." This was my first big client. And I said to them, "Before we go anywhere, I need you to understand, you're gonna have to give me 3 years at least to just explain, to go to the Hill and just blanket the Hill in knowledge. This is what we do. This is how we do it. This is why we do it." Because up to that point, and that was representing substance use disorder professionals, the counselors, and prevention specialists and clinical supervisors. When I started in this space 20 something years ago, I was like most people. My knowledge came from Hollywood. If you were to say to me, what is an SUD counselor? I would have said it's the person who's been in the AA room the longest, So they get there first and set up the chairs and pour the coffee and run the meeting, and they're in charge. They're the counselor. That's not true at all. That is a very well-known, established, and effective model. I do not that is a very necessary model. But there are clinical models too, and that's who I was representing, and they have education, and they have training, and they study the subjects, and there's exams, there's standards, and you can't get anywhere with policy until the people who make the policy understand what it is your people do and accomplish and are trying to achieve. So the biggest challenge it wasn't, "Hey, we need to write these laws." It's, "Hey, this is who we are." And once that was finished, all of a sudden, a few years later, one of the members of Congress who's been very supportive of this issue, Hal Rogers of Kentucky, because of where he's from in Eastern Kentucky and the problems that OxyContin was causing, the phone rings and it's his office. He says, "We need to write legislation on the SUD workforce. Go." So, those were the challenges at first, and they remain a challenge, not as large to this day, but for the most part, there are still too many members of Congress who don't understand what exactly behavioral health entails, and it continues to be probably the biggest priority we have is to educate them.
So, Andrew, I think as an illustration of what we're talking about, and I'm gonna come back to this, but I want to go back to the parity law for just a moment because the parity law when it passed for our industry was massive in terms of getting payers to actually fairly reimburse and recognize mental health care is the same thing as physical health care. Okay, Patrick Kennedy's a friend. And to hear the story from Patrick in terms of how this happened, I would love to get your take on this. We would love to think that the Parity Act was passed because it was the right thing to do, because it just makes sense. It makes sense that, mental health should be on parity with physical health. But the reality of the matter is, in terms of a legislative act, it passed on the tail end of the TARP bill. So it's like, so Ted Kennedy he was like, "Okay, so this is in 2008, we're in the financial crisis," and they're like, "Here's a must-pass legislation, which is the TARP bill, to provide, relief for the failing banks and that whole situation." Ted Kennedy said, "Here's the parity bill, we need to stick it into the TARP bill so that it passes." Would you mind using that as an illustration for our audience to say this is really
Yeah.
unique about it? What's the right thing and also the timing?
And at the risk of alienating my host, you have it backwards.
Oh,
TARP
okay, well, good.
TARP passed on the heels of parity.
Oh,
What
this is
happened was
juicy. This is
this.
juicy. Okay,
Yeah,
good.
what happened was this. There are procedures in Congress, and the House and Senate have different procedures, but TARP needed to pass fast. And this is a very, very abridged version, and maybe Patrick, if he ever watches this, will correct me. But as I remember it, because it needed to pass fast, they couldn't just say, "Here is the package," because they would have to create rules, and they'd have to create blah, blah, blah. They said, "We need a bill that has already passed both chambers, and we're gonna tack on TARP as an amendment." The parity bill was teed up and ready to go. It had, in different forms, made it through all the procedural hoops in the House and Senate. So the House and Senate leaders were looking for a bill to get TARP attached to so it could sail through on the procedural front. And Ted Kennedy said, "I got it. Here you go." So we joke in our circles that without the parity bill, TARP never passes.
You know, I'm so glad that you brought that up, and if Patrick does ever see this, it's like I would love to invite him, an opportunity to, is like to even further clarify this point. So maybe it is true that parity was actually it did happen for all the right
Right place
reasons,
at the right time.
and it was right place at the right time.
It was it to be fair, the work and you mentioned Patrick and I mentioned Carol, and they are good friends. They're both friends of mine.
Mhm.
I've known Patrick for many years as both a congressman and and an advocate, a colleague advocate, and and Patrick remains engaged in this issue. Um, but the work that went into making people understand the need for this and showing how bipartisan it was, because don't forget Pete Domenici of New Mexico, who the bill's named for. I think it's Wellstone Domenici, and Paul Wellstone, before his passing, was a very key player in this too. So I think it's called the Wellstone Domenici Parity Act. And we really did have bipartisan support, and don't sell short that we were right on the doorstep. But again, right place, right time, as so many things in history. Right place, right time, and all the dominoes fall. It's so without all of the work that went into it, that Patrick and his father and Carol and all of us who work on this issue, without all of that, it wouldn't have been on the precipice. I don't know if you guys are golfers, but a friend of mine has a saying, when someone makes a shot and it's lucky, he says, "You make your own luck." He once hit a pitch shot from like 105 yards. It bounces and goes in the hole. And I say, lucky. And he goes, "Well, I picked the club. I made the swing. I put the ball on the green. Okay, the fact that it rolled those last 3 inches into the cup, you could call lucky. But without all those other things, it doesn't go in the hole." And he's right. You make your own luck. All the work that we did for parity to get people to understand that it is the right thing to do, put it right on the precipice, so that at the very end, it just needed that little and in the hole.
Yeah.
Well, okay. Well, I really appreciate I mean, sorry for the pun, the clarity on parody. So I mean, and I
Well,
appreciate, and I really do appreciate and it's like, I think that's helpful. And I think a lot of people are going to appreciate that. Let's go back now and actually talk about that education process to get legislators to actually understand the need, because you've already set us up nicely here. People come to these things with their own understanding, and we need to continue to shape their understanding and shape their education. I'll tell you just a brief story about my background. So I started off in the entertainment industry, and my first foray into advocacy had to do with working with songwriters and working with songwriters' royalty rights as it pertained to streaming and as it pertained to some legislation that was pending. And all of our efforts up into that point was meetings with staff, meetings with representatives, meeting with senators, pleading the case, and then it never made an impact until we actually took the songwriters to Capitol Hill, guitars on their back, and then we went into these offices, and then they played their songs and literally emotionally wrecked these people with their songs. So it's like tears were flowing and people were like going, "Oh my gosh, I can't believe the way, first of all, this comes out of your brain. And then, yeah, of course you need to get paid for the work you do and blah, blah, blah." And so we finally started to get some traction, but you'd like to think that that's enough, but it is rarely enough. It's like, you put all of that energy into making that happen, and you're still years away from something happening. So maybe can you use that little tiny example as
Yeah.
of like what that looks like for you?
Yeah, absolutely. And that's where there's a tried and true formula. I don't want to break your heart, but you're not the only group that
Oh,
comes to
I
Capitol
oh, no,
Hill.
no, no.
you know,
No, I know
it,
that listen, I know that everybody has got the
and
shtick down. Yeah,
it's
yeah,
a
yeah.
it's kind of a game we insiders play. We know what time it is by who's showing up on the Hill. It's like there's a group called the Future Farmers of America,
Yes.
and they're always on Capitol Hill in like late June. And what makes them stand out is they all come in these blue corduroy jackets in late June in Washington, and you're like,
Andrew, it's okay. It's really funny you say this. I just want to jump in because it's like I immediately got this when we walked out of a senator's office and we thought that we were just so amazing, and there was somebody standing out there holding a pig.
yeah,
And
you
it's
know,
like, and it's like
there you go.
the next meeting was going to be Wilbur the talking pig was going to go
There
in
you
and
go.
talk about
So
some agricultural
yeah,
issue.
like every year, the osteopathy students come. They're all over the Hill in their white coats. There's Special Olympics every year.
I
You see
know,
them on the Hill. So, but for us, let's bring it back to behavioral health.
100%.
Yes, we do bring our people to the Hill, and they do tell their stories, and very much like your songwriters, it's tearjerkers. They tell gut wrenching stories, whether it be about their own journeys or their children's or their children who may have unfortunately passed away or loved ones who have passed away. And believe me, I've sat in the rooms with the testimony and seen members of Congress with the tears coming down their face. And actually, just so you know, a little, you know, I feel like I can share a personal with you. I often leave the room when things get that heavy because I need to keep it. I need to keep it at a distance so I can stay focused.
Yes.
If some may people think it's a coping mechanism for me to do my job because I have to keep it almost objective. I gotta present facts and data. People come and they tell their stories, and it is very emotional. But here is the where everything starts to happen. That's the beginning of your story, not the end. Too many people come to Washington and say, "I told my story, I made them cry," or whatever, or laugh, or whatever the case may be. I'm done. Ugh. If you think the staffer or the member that you talk to is gonna remember the conversation with you in a week, you got another thing coming. And that is not an indictment on these people in terms of their intelligence or their ability to handle, you know, the emotional weight of your story. It's about the workload they have. The staffer you are talking to is going to meet with 8 groups a day when they're in session, at least, on ridiculous numbers of issues. If you're lucky enough to handle only 3 issues for a member, let's say you handle health, you handle commerce, and you handle agriculture. In health alone, in 1 week, you're going to meet with groups that represent cancer and diabetes and lupus and HIV and Medicaid, a whole nother can of worms, and on and on and on. Add to that, maybe you have to handle agriculture and you're going to meet with the person who's brought his pig or her pig and soy farmers and fisheries and just forget it. So you've come and you've told your story and you go home. One of my first jobs in DC, we were debriefing after a Hill day, and someone said to me, "How do you think we did today?" And I said, "All right." And they're like, "That's it?" They wanted their accolades.
Right.
I'm like, "You did all right." He goes, "That's it?" I said, "Well, I gotta be honest with you. I can't tell you how you did until I see how you do, because I need you to stay in touch with these people. I need to stay in touch with these people. You're gonna go home, you're gonna say, 'Thanks for meeting.' In 3 months, you're gonna say, 'Just wanted to give you an update.' In 6 months, you're gonna say, 'How are we doing on the grant?' And then you're gonna come back next year and they're gonna go, 'Oh, yeah, I remember you. Hey, thanks for that email,' and guess what? You're gonna come back again. And when you leave, you've lit the flame. People like me, we keep it going. I check in with the staff. Hey, a piece of legislation pops up. Hey, remember what we talked about when so and so was here? This could really, because when a piece of legislation pops up, it's nascent. Just because a piece of legislation pops up about nurses and what they do doesn't mean I can't say to them, this would be really good for the counselors too. Or just because something comes up on HIV doesn't mean I can't say to them, this would also be a really effective model for substance use. So, that's what people like me do. You keep adding to the sausage, you keep grinding it up. So there's roles for everybody, but you have to know you've come in, you've, you know, you've put down you've put your flag in the sand, you've made them cry or laugh or think. That is the beginning. That's not the end. Too many people come to Washington, go home, come back the next year, and they think they're advocates. You're not. That makes you a tourist. Unless you go home and you stay in touch and you make contact with their home offices back in your district and you invite them to take a tour and you let them know about, this story in the newspaper and, "Hey, Congressman X, wouldn't the next time the press comes to visit, wouldn't you like to be here to, do things like that?" It's you've got to keep the sausage is never finished, I guess is what I'm saying. Or the sausage factory never
Y
closes. You
you know
have to keep up. Advocacy is a drumbeat. That's a term of art. It's a background. You ever been to a soccer game where they're beating the drums for 90 minutes, which I was like, it's a drumbeat. You work with the songwriters. You need that backbone. You need that backbeat.
So
It's
so
constant.
so Andrew, I mean, I wanna try to distill down for the audience what just said is like, I mean, so if you could point out just 3 things that you wish people knew about advocacy, I think you've just nailed them. Is I mean, just give us three little tidbits on and what you wish people knew about advocacy.
Okay, advocacy, and the first two are, in my opinion, indisputable. The first is be visible. Out of sight is out of mind, especially in Washington. What I just told you about staffers and what they have to show up everywhere you can. If there's a briefing on Capitol Hill, if there's a hearing, if there is an event, a press event, if there is, be visible, because when the time comes, the staffer is going to say, "Who do I call to talk to about this?" Trust me, be visible. Get in there. You don't have to necessarily get in their faces. Just make sure they know you are there. I once had a White House staffer say to me, he left and he was in a new job. We were having lunch, and the White House is the home of the Office of National Drug Control Policy. And we were just, talking, and he goes, "Man, you showed up at everything." He said, "And don't think we didn't notice. We did." Two, knowledge. I talked before about what a lobbyist is versus an advocate. I don't care what you use. I can't tell you how much of my day, how many hours I spend consuming knowledge about the latest in my space. I get alerts, whether it's from the trades, be they, political trades, CQ Roll Call, Politico, all those, consuming what's going on the Hill. Then there's, the trades for behavioral health. There's Alcohol and Drug Abuse Weekly and all the other publications. Stat News has a great um, segment. They do a lot of coverage on behavioral health. Washington Post has a reporter dedicated to opioids and overdose. Read all of his stuff. Consume knowledge. You have to be educated when you go to talk about this, because 8 times out of 10, maybe you don't get a question. One day, if you get a question that you can't answer, or at the very least say, "I'm gonna have an answer for you tomorrow," you're done. You've gotta have an answer, and you can't make it up. Something I learned in law school: if you don't know the answer, say you don't know the answer. Don't make it up. It's just gonna get worse. You have to consume the knowledge, and you have to know everything that's going on in your space, because you never know. Remember we talked about parity, and I said it was at the precipice, and, we were there to just, watch it, take that last couple of, you never know when opportunity is gonna present itself. Um, it's tough to explain to clients sometimes how much of this situation is hurry up and wait. I can go to meeting after meeting after meeting, nothing, nothing, nothing. At that 8th, ninth, 10th meeting, the right person from the right office who's working on the right legislation is gonna show up. We're gonna talk, and they say, we were kicking around this idea about legislation on, peers. What do you got for me?" You've you only get that opening once. So be visible, be knowledgeable. What's the third? What's number 3? I guess it's a combination of those 2. It's have your advocates in the grassroots, your songwriters, my counselors, my peers, my people in recovery, the people I represent, have them ready to go at a moment's notice, and make sure that when they hear from you, when I say, "Hey, you've gotta contact this office and tell them what's going on." Okay, there's a grant that's funds your program that they're talking about cutting, and you've gotta let them know what it accomplishes in your community. Your grassroots advocate's gotta be on top of it, because one advocate from the district is worth 20 of me. If a congressperson from, the southern part of Colorado hears from someone in their district, "Whoa, you cut this grant and 3,000 people lose their services," they need to hear that, and they need to hear it right
Hmm.
away. No time for, "I'll get to it." when certain things happen. A lot of things in Washington, there's plenty of time because they'll be like, "Oh, we're not ready for that yet. Get back to me in April." But more and more recently, the calendar has been playing havoc with us. You see in the appropriations process, when the federal government doesn't finish appropriations, which is funding for programs in time, we face what is known as a shutdown. And these used to be incredibly rare. Now, every year, we're looking at a potential shutdown because the calendar keeps getting messed with. And when you're dealing with something as volatile as a shutdown and something as sensitive as funding, when a member says to you, "Hey, I need that now," they mean it. So your advocates, I'd say the third thing, have your advocates ready to go at a moment's notice and know that when you say to them, "I'm giving you the green light," you better hit the gas.
Here's who to call, here's what to say,
Here's
right?
Yeah.
that's my job.
Yeah,
Here's who to call, here's what to say, take it away.
got it.
That's really powerful, Andrew. And I guess as you look back over your career, like beyond parody, what have been some of the other things that have stood out to you as, man, I've really made a mark on this industry?
Yeah, um, it's so hard because so much of this is abstract, but I've gotta say, my training and my specialty, my expertise in DC, the way my career's gone, um, has become appropriations, like I said before, which is funding, and ridiculously complex process. In words, it's easy. The House gives a funding number, the Senate gives a funding number, the president signs the bill. But what goes into it in terms of the process of the conversations, the actual clerical filling out of I don't wanna give away too much because then people will be know what the secret sauce is and they won't need me. But the funding levels, I have to say the funding levels um, for SUD and some of the funding mechanisms. And it's really kind of bittersweet because we're still nowhere near where we need to be. But if you had said to me, even just 12 years ago, Andrew, in 12 years, you're gonna have a program that is $1.5 billion going to the states that your people can use to mold the workforce of the future and, provide these services. That's every advocate's dream. It's like there are many programs, and I could list them, but everyone in DC has their baby. I helped write the legislation that authorized that. I cultivated it. I every year come back and I ask for funding for it, and I've watched it grow. So there are programs in workforce. For example, there's a $40 million program for behavioral health workforce called the Star Loan Repayment Act, and no one goes it alone in Washington. I know people who will say, "Look what I did." No, it's "Look what we did." So I can't mention that without mentioning the great people at the American Society of Addiction Medicine, National Association of State Alcohol and Drug Abuse Directors. We all work together on this. So there's a 40 million program for loan repayment for SUD professionals. There's a building communities of recovery for recovery community organizations. When I started my work on that 6 years ago to today, the size of that funding has tripled. It's things like because when you say, "What am I most proud of?" It's hard to give you the abstract examples of minds I've changed and attitudes I've changed. When it comes to funding, I can point to it. I say, "When I took over, that was at $5 million. Today, it's at $17 million." And at the end of the day, I know it sounds some people may think it's crass because the issue we work on is so human and so personal and so emotional. But, what makes the engine run? It's funding. And whether that be in the form of Medicaid, which is very controversial at the moment, whether that be in the form of discretionary programs from SAMHSA or HRSA or NIDA, um, whatever it may be. Hal Rogers, who I mentioned before of Kentucky, was chair of the Appropriations Committee for many, many years. And he has a saying, and he says this a lot to my people, to my groups, a vision without funding is a hallucination. And it's as simple as that, because you may see quite often in Washington an announcement from a member of Congress or the White House, "We passed a law that's gonna do this." Well, guess what? It's not gonna do a damn thing unless those programs are funded. That is half the equation. You've passed this bill. So you'll remember, we talk about accomplishments. I don't know, you probably are familiar with something called the CARA Act, Comprehensive
Yes. Mm.
Addiction and Recovery Act of 2016. That's a point of pride for many advocates. I have a picture of all the advocates at the bill signing ceremony. There's like 80 of us, you know, from law enforcement, substance use, mental health, patient advocates, states, counties, cities. And it's like, it if there was ever a "it takes a village" moment, um, that was one of them. And, but that was every year since 2016, so almost 10 years now, we gotta keep going back and make sure those programs are funded year after year and after year, and they are. So if you were to say to me, like, "What am I most proud of?" That's kinda like that's the work that's almost in the shadows. For someone like me, when it comes to appropriations, yes, my grassroots play a huge role because I wanna make sure the requests come from them. But that's kind of the work that doesn't get a lot of ink. And, it's kind of like if you were to say to me, "Prove you're a master of your craft," that's what I would point to.
You know, one of the things that we talked about, Andrew, um, the difference between policy and politics, and then I would love for you to give us just a sense for what kind of where are the trade winds right now as it pertains to our industry in this current environment? Because it does feel like those trade winds have shifted.
Yeah. Policy versus politics. This is what you have to explain to everyone outside the Beltway. I've got friends all over the country. I went to school in the Midwest, which gave me friends from, like, all over the country, and, just people move around a lot, and you tell them you work in Washington, and they all get the same idea. They all automatically assume you work in politics. Politics is Democrats versus Republicans. No, I don't work for the DNC or the RNC, you know? I work on policy. I work on funding, legislation, communications, messaging. I work on policy. Now, politics and policy, are they gonna merge? Of course they are. The political environment will have a huge impact on anyone working on policy, because you can go to the Hill and let's say, you know, take right now, for example. Let's say you're working on behavioral health and you go to an office and that guy happens to be on the intelligence committee. The staffers will tell you straight up, "Hey, we've got Venezuela, we've got, Maduro, we've got all this stuff going on. We don't have time for this right now." So the politics are affecting your ability to work on policy. So there will always be a place where they meet. So I don't look at it in terms of, oh, it's a Democrat, so it's a good bill, or it's a Republican, it's a good bill, or vice versa. It's a bad bill because it came from this office. I look at the bill. And I don't care. I have seen some of the best legislation ever written from both sides of the aisle, and I have seen some of the worst from both sides of the aisle. Just when you read a piece of legislation from a Republican, you're like, what are they thinking? A week later, you'll see a piece from a Democrat saying, oh my God, this is even worse. No one has a monopoly on good ideas. No one has a monopoly on bad ideas. House, Senate, Democrat, Republican. So, I try and always focus on what is on the page in front of me. Now, the politics will come back with who can I get to support this? If you'll think back to the days of the ACA, the Affordable Care Act, there was an era where Republicans were hesitant to support anything that in the healthcare realm simply because of the ACA. Okay, the politics are going to affect the policy. You just got to accept it and move forward. But then there's ways around that. Okay, I mentioned the CARA before. A lot of people, What did we do to get around the tricky parts? We went through the criminal justice side of things. This is programs in jails and prisons and release and reentry and probation for people who have a substance use disorder. This isn't a healthcare issue. This is a criminal justice issue. There's always more than one way to skin a cat, especially in Washington. So you got to look for those different touch points where your politics and policy can hopefully not butt up against each other, and you can get down to the process of actually accomplishing something.
I wish somebody would advocate for all those skinned cats that are in Washington, you know? Um, no, let me go back to the question, like the trade winds currently for, so how are they blowing? And then it's like,
Yeah.
and how have they shifted?
Okay.
Because I
Yeah.
think our audience would
We're
love to
gonna
know that.
your audience is gonna wanna know this, and this is really the meat of the conversation. We're in a tricky spot right now. We're in a very, very tricky spot for a variety of reasons. Let me just make it as plain as possible from what's on the paper in front of me. All of healthcare is in a great degree of limbo right now due to the current political environment. We are going through upheavals in the healthcare system, the likes of which we've never seen. Um, and I do have friends who work in the space of, let's say, of vaccinations or autism or the other more high profile issues coming out of HHS right now. My heart's with them. And as a concerned person, as a concerned citizen, I do follow those issues. Um, we are in a tough spot because of the approach of the federal government that started in last January with DOGE and continues with the policies of the current Office of Management and Budget, which sets spending and budgetary priorities, that wants to see cuts across the federal government across the board. So you start with the greater universe of just government spending. 70 to 80% of all SUD care, here's why this is important. I don't know about cancer, I don't know about diabetes, I don't know about AIDS. 70 to 80% of all dollars that go towards the care of substance use disorders are federal dollars. Now, that can come from a variety of sources. Medicare and Medicaid. What a lot of people don't realize is how much of that comes from Veterans Affairs, how much of that comes from the Department of Defense. And then you've got the grants that come out of HHS, from SAMHSA, HRSA, other CDC, other agencies. So at the end of the day, 70 to 80% of all coverage of all money spent on SUD care is federal. So when you have an administration and members of Congress that say federal funds are just going to have to, this much off the top, you automatically start to worry. So that's the universe. Then let's get to the galaxy of just health. Health was not immune. We saw recommended cuts, whether they be DOGE or from the Office of Management and Budget, recommended cuts to SAMHSA, the CDC, and the CDC is very important because of its overdose to action initiative and other initiatives, the other roles they play on overdose. Not only did we see proposed cuts, we saw proposed reorganizations of the entire HHS, which is, you get ready for the calendar year and you're like, this is what I'm going to be working on here, here, and here. So last January, when I'm like, okay, and then I'll start on appropriations and then I'll start on this other stuff. Well, it wasn't. They were talking about the agency not even existing when we're talking about SAMHSA, because HHS wanted to merge it with other agencies into a larger Administration for a Healthy America, which is still on hold. So that's the galaxy. Healthcare, in general, across the board at HHS is very much in a moment of upheaval. Okay, now let's get to the solar system of behavioral health. The proposals from the White House for the cutting of funds at these agencies was pretty drastic. If you look at the budget document, and somewhere in this mess that I call my desk and all my papers, somewhere in there is a document of the presidential proposed 2026 budget, which, with the exception of a few programs at SAMHSA, wanted to get rid of close to $800 million in discretionary grants for substance use care. I didn't even calculate the mental health side because most of the appropriations work I do is on SUD, not mental health. Some of the policy work I do is mental health, but so they wanted to eliminate close to $800 million worth of programs at SAMHSA. Congress did not go along. The Senate proposed to fund everything at last year's levels, which in this environment was excellent. The House proposed to fund not as much as the Senate, but not nearly quite the drastic cuts that the White House proposed. Most importantly, the House and the Senate both proposed in their appropriations documents that SAMHSA stay as SAMHSA, HRSA stay as HRSA, and the CDC stay as the CDC. That story remains yet to be written. Um, okay, so that's the current environment when it comes to the funding, as I say, is critically important. That's the discretionary funding. We are coming up on a Medicaid environment that's gonna see some drastic changes with the work requirements. Now, a lot remains to be written on that as well. There's something called the rulemaking process that they didn't teach you on Schoolhouse Rock. The secretary holds great power in saying what exceptions can be made, what implementations can be made, on and on and on. So we still don't know if the work requirements and other reporting requirements are going to apply to our populations because they may be given an exemption, as they have at times in the past. So we don't know how that's all going to work out. Now, okay, so we've looked at the galaxy, the universe, the galaxy, and the solar system. So now let's get to planet Earth, behavioral health, SUD care. It is no secret to anybody that this White House, their approach to the what they call the drug problem, I prefer the term SUD because I look from a clinical model. Their approach is to bring back the war on drugs. I don't think that's up for debate. I consider myself well-informed, well-read. I just went on for many minutes at the beginning of this podcast trying to explain to you how important it is to be well-informed. What we see in Venezuela, what we see in terms of the focus on the Mexican border, what we see in terms of the focus on fentanyl seizures. The top priority of this administration is on what we call the supply side. I have not yet seen the support I'd like to see on the what we call demand side, which is all those programs at SAMHSA I talked about before. So we are in an environment or a universe, whatever you want to call it, where the White House um, is bucking a trend that we thought was going in the right direction. Reagan, I think it was something like 70% of the budget for drugs in this country was on the supply side and 30% was on the demand side, treatment. We slowly started to see that come down and, under Clinton and Bush, Obama. By the end of the Obama administration, we were just about 50-50. 50% spent on interdiction, 50% spent on prevention and treatment. In the first Trump administration, I'll be honest, there weren't that many changes in the budget. I think the attitude, if you'll remember in Trump's first term, he was very adamant that drug dealers get the death penalty. Or that was one of his big policy ideas. I don't think it ever came to pass. But even though the rhetoric was more on the war on drugs side of things, the reality of the budgets, they weren't that impacted. We actually did okay. And President Trump signed the Support Act in 2018, which created some great programs for recovery, President Trump also had a commission on opiates and overdose that was Patrick Kennedy, I believe, was a part of that commission, as was Chris Christie of New Jersey, and some very, well-respected politicians and public affairs people and they made a list of good recommendations. Many, weren't seen through, but we didn't really experience a lot of problems with the budgetary side of things in the first Trump administration. Biden administration comes, we saw record-setting investments in recovery. Like I said, those numbers started for those programs that I work on for recovery community organization for peers, those numbers really started to take off. now, for the first time in decades, we are working with an administration that has proposed actual cuts to those numbers. So we're in a tricky spot. I don't think anyone can accuse me of, I'm not being partisan. It's the numbers are on the page. Um, and that's where we're at. We're in a tricky spot. I want to say, I want to take advantage of this time to say our allies in Congress have been very, very good to us through all of this. I want to say that the members of the Appropriations Committee in the Senate, led by Shelley Moore Capito of West Virginia, a Republican, and Patty Murray of Washington, a Democrat, produced a appropriations bill that could not have been more bipartisan. Are tensions high in Washington? Yeah. Is it partisan? Yeah. But that doesn't mean that you still can't work together on issues that you agree on, and it still does happen. I say that, yeah, I joke with my friends who are in the media and reporters, I'm like, "Hey, they just produced a great bipartisan bill, why don't you do a story on that?" And the joke is, "Well, Andrew, we don't write stories on the planes that land." You know? So, there is still a sense that we can still achieve if we can just find the right opening. But it's a tough spot, and the openings are few and far between.
You did a really nice job of visualizing this, and so you said, like, in the Obama administration, we got to 50-50, and it's like, what would you say that spread is right now in terms of demand and supply?
It's tough to say because the budgets are inside between Doge and staff cuts and everything else. We're gonna have to come back and revisit this, once this year's budgets are finished, because we're still in the first appropriation cycle of the Trump presidency. If we get the legislation from the appropriations committees that we want, we still may be in decent state. We still may be close to that 50-50. Also, I don't know if these operations in Venezuela, which are under the auspices of narco-terrorism, I'm not speculating that he's going after Maduro because, or at least the issue in the media given by the White House, he's been arrested for narco-terrorism. It is a drug issue. I don't know if the money spent on that is military intelligence or if it's DEA. Because if it's not DEA, it doesn't figure into the equation.
Got it.
So it's a very tough question, and we're also going to need to see where the chips fall as a result of Doge. Because let's say we get all the funding, all of my paperwork I just showed you with all the funding numbers and everything. Because of the staff cuts at HHS, we don't know how many of those grants can actually be executed simply by loss of manpower. That's going to be a very tricky thing to keep our eye on. So that's one thing I do. That's, like you said, lobbyist versus advocate. If I'm keeping an eye on SAMHSA and I'm tracking the grants going out, and I want to know that these grants are going to these recipients on these dates when they should be, but they're not because of staffing losses, that's not lobbying. That's me doing my job. That's where the knowledge comes in. So that's the difference between what I do and a lobbyist, because I spend hours a month, each week and each month, going through those SAMHSA numbers, saying, where are these grants going? This is going to this state. I got to talk to this congressman to let them know that this money is in their district, and all the way down the line. That's not lobbying. It's not. It's called it's educating. And I had, just for an example, when all this was going on with Doge and grants were being held up, and I would talk to my grassroots people out in the States, and I said, if you were supposed to get grant money and you didn't get it, call your congressman. And they said, I can't. I'm a 501c3. I can't lobby. I said, that is not lobbying. If you have a grant with SAMHSA and they owe you the money and you don't get it, that's what your member of Congress is for. That's why they are there.
That's constituent services.
That's a constituent service. Exactly. That's
Right.
like, I didn't get my VA check. I didn't get my Social Security, my Medicaid. That is constituent services. That is not lobbying. That is, hey, the federal government said they were going to do this for me and they didn't, and I need you to help me. So there's a variety of things we can do to make sure, or that we're going to have to do to see where the chips fall once we go through the next fiscal year, and that money, let's cross our fingers and say Samson gets all the money they should. Is that money then going to get to the people who have contractually been awarded the money?
Yeah.
So the answer the answer in general is like there's a lot of reasons to be concerned, and it depends. There's still a lot of uncertainty, and we need to be watching very carefully.
Are you a fan of the greatest show in television history, The Simpsons? Um,
Of course.
Reverend Lovejoy was once asked a question, and he said, "Well, short answer, yes with a but. Long answer, no with an if." So
We don't
that's basically where
it just
we're
goes
at,
it just goes to show that the entire world can be boiled down to The Simpsons, you
Yeah.
know?
without a doubt.
Totally. Andrew, thanks so much for being a part of the show today. This has been fabulous. I think,
We're gonna have you back for an update.
yeah,
Oh,
we're definitely
my
going to
pleasure.
have you back on the show.
Yeah.
So, but thanks again. And for our audience, that's a wrap for today's episode. On behalf of Jeff and myself and the entire Mastermind crew, I just want to say thank you for tuning in today. If today's conversation with Andrew sparked anything with you around like advocacy, leadership, policy, please drop some comments into the comment section, and we'll get them over to Andrew and have him answer them for you if you have anything specific. Be sure to also subscribe, rate, and review this show so that we can get a Mastermind out to more people in need. So we'll see you next time on Mastermind.
That wraps up this episode of Mastermind. Thank you so much for joining us. And remember, Mastermind is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on Mastermind, your behavioral health playbook.